And I just had to close my books, and there wasn't any other way. So I guess that happens, and then then there's pressure on politicians.
Yeah.
We just have to get more people into general practice. We won't get them in unless we make it attractive for them.
So AI,
Mm.
what do you think about it? Hello and welcome back to Bedside Murmurs, a podcast where we chat with doctors about their careers, pathways in medicine, clinical tips, and much more. This podcast is made possible by the lovely support of every one of our amazing listeners, and I just want to say on behalf of the entire Bedside Murmurs team, thank you to everyone who has given us support. And we have some big plans for this podcast going into 2024, and it's an absolute blessing and pleasure to have you along for the ride. If you have any questions or any ideas on guests you would like to see on the show, please shoot us an email at podcast@medsoc.org.au. That's podcast@medsoc.org.au. I'm Sean.
And I'm Emily. We will be your hosts for today. Our first guest for 2024 is a much-loved member of UNSW Medicine. She has had 25 years' experience as a GP at the University of Sydney Health Service and has been running clinical skills and scenario groups at UNSW for the last 10 years. She has been instrumental in producing clinical skills courses for students throughout all phases, and her well-known possum pointers have helped many students pass their OSCEs. Most of all, she is incredibly passionate about her career as a GP and an educator, and about helping students to thrive and survive in medical school. Please welcome the lovely Dr. Sue Britton. Hello, Dr. Sue Britton. How are you?
I'm very good, thanks.
All right, so are you excited to be on our first episode of Bedside Murmurs?
Oh, that's so
I
exciting.
love techie things like this. It's great.
Yeah, well, welcome to the new media room. I had no idea this existed in the university, but it is here. So, yeah, let's start. The first question that we really had was, you're a general practitioner, and you're also an absolutely amazing educator. What drew you to general practice in the first place?
That I wanted to be across everything in medicine, not just some little niche, you know. And why did I do it? And they just opened the GP training scheme. It was the second year of it ever. And I thought, I'll go and train as being a GP. And that was at Hornsby Hospital back then. And so it was really fun being on the ground of a new course. And in fact, there's probably helped me with my role in education. There's seeing how they developed that course. Anyway, we digress. So I wanted to be across everything. Yeah.
Okay, and it sounds like you have a lot of interests. Do you think that there was anything in particular which really sparked your passion for general practice and that desire to know everything and learn about everything?
I think was the placement when I was a student with a GP, Jan Haskins, and I just trailed around with her for a few days and I thought, this is fantastic. You know, we just went from one cardio thing and then to a neuro thing and then, you know, a kid with a sore throat. And it was just the variety that got me in. And then Jan, you know, explained to me how it's so flexible, you know, that she'd had children and you can, because you're in a big group, you can take school holidays off and there's people to cover. Whereas if you're a hospital specialist, you've got to be there. You know, they don't hold a hospital, they don't hold the surgical theatres empty while you go off on your leave. And so they were very fixed with 1 month off. And I think Jan Haskins inspired me too. Yeah. Yeah.
Yeah, and you were mentioning before, you were talking about how you have like quite a lot of interests.
I do.
How have you found that your career as a GP has kind of been able to suit you and your different interests, and how did you be able to balance that?
Well, I think that's what general practice is. It's flexible. And so I really, you know, I think, I can't say any more, it just has a flexibility about it that means you can take a morning off if you plan it ahead enough that they haven't booked patients, bless them. Because we're a group, and so it gave me opportunities to do things that I know that my specialist friends didn't have a chance to do.
And you mentioned you work in a group. Could you elaborate on what that group is and what it looks like day to day?
Right now, it's different because I've got really, 0.6 of the week teaching, and so but before I was in the Sydney Uni Health Service, and so it's very like the UNSW one, and so we had a group of 8 doctors equivalent full time, and we had nurses and we had physios and we had the visiting skin specialist, visiting psychiatrist. So it was fantastic group thing, and it is down at New South now because I worked briefly there when I started teaching at New South. And so, and within the group we have different sub-interests, and so, we knew Sue Willis was interested in paediatrics, and so if there was a child with more complicated long-term things, we could send them in Sue's direction. And then I was much more interested in women's health and I guess hormonal medicine, probably mental health was one of my interest areas. I was quite good at sports med because I maintained keeping fit. So we just had our interests. It was just fantastic, really. I was sorry to leave that sort of setting of general practice, but I had done it for 25 years. Then I got sucked into teaching, and I've loved that too. Yeah.
Yeah. So you are an educator within this uni, within UNSW. In the most recent Medical Dean's Report, only around 13.1% of medical graduates say they want to pursue a career as a GP, which is the lowest proportion since 2012. What is your perspective on the current interest in general practice for medical students?
I could see it happening. So when I went in, about 56% of us wanted to do general practice. So it was a very popular career. And it was well paid, was up there with the specialists. And so, but over the years, because of the Medicare system and bulk billing, which I very much believe in, I think all medicine should be free to everybody, is like in Finland, in Scandinavia. But what the successive governments did was just cut. It didn't put the rebate up. It just didn't keep up. And so eventually people were trying to do 6-minute medicine to just see enough patients in a day to keep the income up. And then it's reached a crunch point in the last couple of years. And what people like my GP are doing is they don't bulk bill. And as Misaki said, whereas she was charging, say you got $40 roughly for a standard consultation and you had to pay your 40% practice costs out of that, what you were left with was ridiculous if you were bulk billing. Now she charges $80 and the patients have a gap of $40, but that is all profit. And Misaki said it's just a dramatic shift. And I think it's sad because I think that disadvantages the working poorer people. But I don't know how we're not going to attract you young guys in with a really pathetic income. So I do think income's been a major factor. Because the work itself is really fun. I mean, really fun. You can do, I used to do some, you can stitch things up and you can do the bits you want to do and then refer the bits you don't want to onto someone else. But you remain the project manager for the patient. So you and the patient meet again and listen to what this specialist said and that one said. And I learned so much from that. You're just seeing us resolving, their various difficulties. And patients obviously have multi-system disease. And so our job really is to integrate the different specialists. And I loved that. It was just fascinating to see.
Yeah. Do you think the barrier is mostly the fact that the income is not that much?
That's my observation, I think. Yeah, this is poorly paid, that the GPs that people see are under such pressure to do quick consultations because you get paid more for the shorter consultations than the longer ones. And so I think people could see it was just, you couldn't do detailed, the sort of medicine we're teaching you was almost impossible if you wanted any kind of a reasonable income. That's my opinion.
Is there anything that you wish you knew before becoming a GP?
Everything. I think that's what I'm trying to teach you, the possum pointers are about things like empathy. We've all got empathy, but how do you express that to someone who's a stranger and sitting in your room? You can't just give them a big hug. That's, just not the way to go. And so I felt like I hadn't been trained in empathy, how to deal with the angry patient or the very depressed patient or the psychotic patient. We had none of that. And so I'm trying to turn that around. Yeah.
And do you find that students have been responding well to those new things that you're introducing in the medical curriculum, talking about empathy,
been good,
etc.?
Yeah. So as far as I know. I mean, we rely on your feedback, guys. Yeah, and give us it as it is. Like, because then we can adapt what we're doing. Yeah.
And have you found that medical school itself has changed a lot since you were in medical school?
Heaps.
In what ways?
In good or bad ways?
Oh, well, no, I think it's much better run now.
Oh,
I mean,
okay.
much better, yeah. Like, you get into hospitals from fairly early on, so you see really what you're aiming for, like to understand this person lying in this bed. And although I think in phase 1, you're still sort of overwhelmed because you don't know any pathology, but once you get into third year, you pretty rapidly start to know the illnesses, and suddenly common things occur commonly, and suddenly this patient sitting in front of you with cardiac failure, you get it, and you start to see that how we manage it. And I see the shift in you guys as you get more senior, and the 6 years are outstanding. They really speak my language. Yeah.
Yeah, so you think med school right now is run much better than it was in the past?
I think phase 1 is run better than phase 2 and 3. I don't know what you're experiencing with the lecture system in third year, but the phase 1 lectures, we've got them on 360, so you can play them over slowly and stop and do things. You really, and we release the slides, and I think that's not so well organised, is it, in third year?
It occurs to an extent, I would say.
There is some organizational structure to it.
Yeah.
It's a little bit confusing. It's a little bit more hands-off, which I think is probably a good thing for students to develop a little bit more initiative.
Yeah,
Yeah, I
I mean, you really do in the end. Nobody's telling me what to learn. I have to be self-directed. And then once you're a doctor, that's it. I have to chase up what the new medications are for diabetes and all the rest of it.
Do you find that being a general practitioner gives you lots of opportunities to learn new things and to be really involved in research?
Yeah, you can. I've not put my hand up to do research. I find that too. I prefer practicing. Like I've not put my hand up at the university to be an administrator, as you probably noticed. And so Callie, bless him, has taken over clinical skills, the administrative role. I just like the actual face-to-face teaching and actual face-to-face with patients and learning new things. I mean, every patient is interesting, and there's always new stuff coming through every day in medicine. And I find that exciting.
So based on that, what advice would you give to medical students and junior doctors that are just starting out?
I'll really consider general practice. Yeah, I think you're luckily, you guys are at this point where general practice reached a nadir, which I wasn't particularly in because I shifted to teaching 10 years ago, but I could see it getting worse and worse for my friends and people giving up because it just wasn't financially viable, and you work so hard and you feel under pressure of time. Anyway, so but it reached this sort of rock bottom, and I think now it's turning up. So I think by the time you get through, it will be much more viable as a career.
Yeah. Yeah, you said it is turning up. What are the shifts that kind of have happened to allow general practice to be a more viable career, and especially financially?
Well, financially, it's just that people aren't bulk billing now, and then the government got the message about where people are bulk billing, say pensioners and concession card holders. They've increased the fee for that. And so, by $20 a consultation, it's not brilliant, but it's definitely better than nothing. And what else have they made better? I think we have to shift to rewarding the longer consultations better. At the moment, it got called 6-minute medicine because you got paid so much more for doing a 6-minute consultation and doing, more of those per hour than 2 long consultations. But the complexity of patients really, and the rewards come from really getting to understand that patient in depth rather than just trying to see them in a hurry and shoot them through. And I think they're hearing that message. Yeah.
So it sounds like there have been some positive changes,
Oh,
but there's
really
still more to
have.
come.
Yeah. Yep.
what would be the biggest thing that would need to change? Like if you had something that you needed to change like right now within the general practice sphere that will bring a lot more people into general practice, what do you think it would be?
I think reward the longer consultations better, to allow complex medicine to be rewarded properly, because we've got the ageing of the population, and once people are older, it's multi-system disease. It's not like one of you guys coming in with a really bad cough the day before an exam. It's multi-system, and you just can't do that in those short times and feel like you're in control of what's happening. Yep.
Yeah. I want to like follow that up with a little bit more, because if you have a long consultation, you are talking to a patient for a longer period of time, which does mean that you'll be able to see less patients throughout the day.
It's true.
If that's the case, how would you manage like the patient load, if that makes sense?
Well, we can't do any more. General practice at the moment are just, if you're not in that practice, a lot of them have closed their books. I mean, essentially, before I finished, doing full-time general practice, I was booked 3 months ahead and closed my books because I got well-known at Sydney Uni, really well-known, and I had all my graduates would come back and I loved them all. And I just had to close my books, and there wasn't any other way. So I guess that happens, and then there's pressure on politicians. We just have to get more people into general practice. We won't get them in unless we make it attractive for them.
So would you say it's like kind of like a chicken egg situation where increasing the financial incentives will bring more people in, which allows for a little bit more, like there's more books to fill, there's more patients to see, and it allows for more longer consultations. Yeah,
and just don't lose the older GPs. I mean, the people in my generation, the 50-plussers, just think, why am I doing this, in these current conditions? Yeah.
It sounds like you're very busy and you have a lot on. How do you manage to maintain work-life balance well?
I'm strict about it. When I'm off, I'm off. And I really basically have a to-do list, and I have a list for each day. It's very nerdy, and but we are very busy. I had to be here at 10 to 12. I'm here at 10 to 12. Do you know what I mean? Like, I just do that. And I guess most doctors do, because we just become time management's a big deal. And then when I'm off, I'm off. I go up to my river house and I'm out kayaking and swimming and doing all those things. And you're allowed time off, you guys. Pick a time on the weekend and you just don't do schoolwork. And
do you find that the workload has increased since medical school, or around the same?
I don't know. It's just, you can only fit what you can fit in a day. And so that's why I left the sort of general practice setting even at New South, because I was doing 2 days a week. It's 3 days teaching, 2 days in the practice. But if somebody came in with results like a potassium of 2.4 overnight, because I can get the results down in the morning, for example, I wasn't going to be there till Friday. And so I've then got to ring Richard Ing or somebody and just say, Richard, can you follow this patient up for me? And that became so hard that I sadly had to leave that sort of GP setting. And now I just do much more confined things that I can sort of do in the day. I haven't got results coming in that I've got to deal with urgently.
That sounds good. AI. What do you think about it? You seem like you have a lot of thoughts just bubbling up.
Way to go. Yeah, I think, I was at the VR demonstration last week. And so we had the Meta goggles.
The Meta Quest?
Yeah. And
amazing.
Yeah, amazing. And Scoot Airlines had developed a program to teach the stewards how to deal with difficult passengers.
Wow, yeah.
Okay.
That's so cool.
And so I was talking to I was in this, and you're in a plane and there's the passenger sitting there, and it just felt like you were truly in it because you were in this VR reality. And so he was really upset about the guy in front of him had pushed his seat back, and so, all this sort of just irritable stuff. And so my job was to, or the steward's job that I was practicing it, was to calm an angry person down. And luckily my GP training, I was good at that. And then it at the end, it was quite amazing. I hadn't realised, but it then gave me a mark on my wording and my body language in dealing with a difficult
Oh, that's so cool.
passenger.
Yeah.
So it said I did a very good job. So you'll be glad to hear that.
Well done, Sue.
Congratulations.
Deal with this difficult passenger. And the formula of managing angry people is quite simple, but somebody needs to teach you. Yeah,
So do you think AI offers a lot of potential for
I do. I think that would
Training?
enable you guys to deal with all the angry patient and the psychotic patient and all of that if we script it.
Yeah.
It's very new. There are some other universities who are interested. And I think Silas Taylor, as you know, has left clinical skills and moved into a role where his job is to look at where we can use technology
Oh, that's so cool.
teaching across the campus. And so I think that Silas is very interested in using VR is obviously, it to me is the sort of, the groovy new thing.
Yeah.
But we've also got AR, augmented reality, which is a flat screen, but you've still got the patient talking back to you and interacting with you and assessing your body language and you can just do that quietly on your own and stuff up, and then go and think about how you go ask somebody how you could do this better and keep practicing. That would have helped me so much when I first graduated. And how to deliver bad news, how to
For sure. Yeah.
all those things that that really are very difficult, I'd have to say, at the beginning. And then once you understand the basic formula of expressing empathy and, how to talk to somebody who's really stressed, it becomes so much easier.
Yeah, it's really interesting. You said that Scoot Airlines had the VR and it gave you a score. I think there's a company that's doing a very similar thing with OSCEs, and what they would do is and a few other universities has done this as well. And essentially, it's a platform where you go and there will be simulated patients where you can try and talk to them. You can give them counseling. You can give them essentially an OSCE scenario, and it will give you a mark at the end. It will use an AI to provide you with, this is what you did well, this is what you did not do well, and it gives very personalized feedback because it's able to learn from your behaviors. It's able to see what you did well, what you didn't do well. Do you see the potential in that for marking as well? So it's like, I think from a university perspective, there's AI is only going to get better and better and better. From a marketing perspective, have you guys ever thought about utilizing AI as a form of marketing?
Oh, I think we're very interested in it. As soon as I heard about ChatGPT, the university went into this frenzy of anxiety about it. Students will be sending in their assignments written by ChatGPT. I just think we have to embrace these new possibilities. And the first thing I was going was, can it mark the assignments? Having just spent it. Yes. Mark 27 assignments, and they take about 45 minutes each, 40 to 45, and you've got 27. That's a lot of my time. So I'm very interested, but we've all discovered ChatGPT at the moment. I can pick a ChatGPT written thing because it's, it's flowery rubbish, really, isn't it? Yeah. Very generalized sort of content.
It does give very generalized
But
content,
it will get better.
But it will get better. I don't know if you've tried like the newer versions of GPT, like the ones that you pay for.
I haven't.
Yeah.
Cheapskate. Because I have no particular use for it in everyday life
Yes.
yet.
And that's so interesting you bring that up, because I talk to a lot of people and they go like, oh, ChatGPT is so useless because it talks very flowery, it doesn't get to the point, doesn't have very cognitive, it doesn't have very good supposed cognitive reasoning skills. And usually what I do is I go, I have the paid version. Do you want to try it? And do you want to see what it looks like? And they try it and they realize, wait, the newer version does everything I needed to do. It doesn't do the flowery language. It gives you precise information. You can search the web. It can find deals. I can do whatever it wants to do. And then suddenly, this is now really useful tool. And it's only going to get better. The new Figure 01 that came out, like the reasoning is insane on that thing. Where do you project and where do you see this kind of heading?
I think it's inevitable that it's going to come in, and that's Silas's job, which is exciting, really. And so I talk with him and hear where he's up to, and I think it's inevitable. And
but I think
and we've already
fear,
got
right?
the feedback, haven't we? That quite often the AI is perceived by the patient to be more empathic.
Yes,
some of the trained physicians. I mean, there was an article came out in The Lancet about that. So we definitely need you possums trained up on expressing empathy.
Yeah.
I don't understand at the moment whether to what extent it can replace human beings. It's certainly, I mean, I use it daily. It's doing diagnostics. If I put somebody on a treadmill, for example, and I'm monitoring their heart as they run, the AI is giving me its opinions about.
Oh, okay.
But it gives every possible interpretation.
Yes.
It's not at the moment integrating the clinical.
Yeah.
It might be saying somebody's having an infarct, and anyway, too much detail, but definitely I've got to put my input into it. But it gives me all the possibilities, and it's reading chest X-rays and doing some of the basic static things pretty well.
But more so a tool right now rather than a replacement for your role.
Yeah, definitely just a tool.
But can you see it in the
Can you see
future?
it being like
Yeah, definitely.
Okay.
I mean, in the bits that it can do reliably, why wouldn't we get it to do it? And it's better than us at considering all the diagnostic possibilities. Because, I mean, that's the lovely thing about general practice. Everything eventually comes through my room.
Yeah.
But it will include what we call the zebras amongst the horses over the hill. And they're the ones that are, tricky diagnoses that are presenting in rather ordinary ways. And it's hard for me to keep all those possible because I've got the cognitive bias that the common things occur commonly. The computer doesn't do that. So
it just gives everything.
It will give me everything. Sometimes it's too exhaustive. There are issues with it. But no, I definitely think I'm sure we will be using it.
And how would that change how we do medical school now? Because there's obviously certain aspects, for example, in pharmacology, where you have to memorize multiple dosages and multiple drugs and all of that. That's much more difficult for a human to do. But for example, even like just any of the pharmaceutical websites will have all that information. So we kind of already go to the internet to kind of do a lot of our medicine for us. And I think it will be very much true in general practice. If you have a patient where you want to give a certain drug, you still look up the dosages. Before
It's on my computer.
Yeah,
so I
it's all
just type in. I have to know what to put in. So I have to know what I'm looking for, but it will give me ranges of options around that. It will tell me the interactions with the other medications this patient's on. That's pretty useful. Trouble is, it gives you every interaction. Then you've got to decide. You probably
which ones are the useful ones, right?
Yeah. But you have to make the exact call about which interaction I'm going to tolerate because I really do want this medication.
Yeah. So I guess the question is, given that that's kind of the landscape of medicine that we're going to be graduating and practicing within, is there changes in how we maybe either test or changes in how we educate people on?
There's no question about it. I mean, I think it can train you, back to the Scoot thing, on communication skills. I mean, as you know, patients have no way to know how good I am at anything I do. All they can judge is whether they like me and trust me. I was thinking that, I was seeing a lawyer this morning to get some documents signed, and I thought, all I can judge about this guy is whether I like him. I have no idea whether he's good at what he does. And it's exactly the same in medicine. And so we need you to have very good communication skills. We're going to mark you on it. I think the AI can definitely help us with training, that sort of thing. And certainly with diagnostics, I think it can help us. But the the limitation I've seen in the sort of ones is the quality of the input. Like,
Yeah.
you know, when we
It's like the prompt engineering kind of thing.
yeah, the prompt engineering. Yeah, this is probably too techie for this. Yeah, I guess I'm interested in it. But
And I know that in fourth year, if you decide to do the honours stream, there is a particular course you can do on AI and research in that. But I think there definitely is scope to expand that to broader years in medicine, because it seems like it's going to be such an important part of our future careers.
and you just have to know how to manage it, really. I mean, I'm growing up with it, you're growing up with it, and eventually the course, I guess, will embrace it and teach it.
Yeah.
But we're just on that cusp of that at the moment.
What
Go for it.
What about patients using AI for self-diagnosis and things like that? Have you found that to be an issue at all?
I haven't really met patients doing that. They're just still doing Google searches and
Which
really
is a very
haven't-
similar thing.
Well, I haven't really been trained how to pick, you know, shit source from a reliable one.
Yeah.
I mean, in Finland, they're teaching children really from junior school how to test the validity of sources.
Oh, wow. Okay.
And we're just not doing that here yet. And so people they come in with all kinds of things they've read on the net that are just claims which have, you know, no evidence base. And we have to teach you ways to respectfully help the patient around that. You know, you can't just go, oh, that's rubbish, I don't believe that. You know.
So I guess it's something that happens. It might happen more in the future, but learning how to navigate that will be a big learning curve.
Yeah. And
Yeah. Assessments. AI in assessments. What are the thoughts right now in faculty in terms of people either using it for things like IA or also using it for like portfolio or using it for the open book exams? Is there any ways, what is the perspective of faculty in terms of how to mitigate the use?
I think what we have to do is decide, what do we want a doctor to know without AI? And then where are we perfectly happy for you to jump in and use the AI? I mean, we always look stuff up. I look stuff up. The computer is, you know, when I type stuff in, it's giving me a whole lot of AI-generated information. So I think it's a paradigm shift about what we actually want the doctor to just know versus what we expect them to look up or would be prompted by the AI. And I hear that talk slowly coming. I mean, the 8 capabilities were what we thought a doctor should know when this course was originally written about 25 years ago. And it was brilliant at the time. You know, each of those are incredibly important parts of my practice. But it's just different now, and that's why we're writing the new course. And people like Joel Ree, you know, has put his hand up, bless him, to run the GP section of it, is what do we want you guys to know as GPs? And what can you just look up, or the computer will tell you?
But it's difficult when we're still in this in-between of there's AI being introduced, but we don't know what it's going to be like in the future. So how do you prepare for the future, I guess, is really the core conundrum.
Well, all of us, yeah. And you guys are just on that transition. But that's so exciting, yeah, to me. You know, just to see as it evolves. You just put your hand up to be interested, you know, if they have evenings on how AI is going to be used. And that's Silas's job, really, and pretty exciting role for him.
Sounds good.
Yeah. Closing remarks, maybe?
Closing remarks? Oh, I don't know. I don't know how the closing remarks work. We had really not planned this far, to be completely honest.
Might need editing because
Yeah.
there's so much tech
Yeah,
talk.
there was so much tech talk, but like I think it's very, very interesting.
Yeah.
There's things that people want to know, and it's like it seems. I think from my perspective, especially when I try to talk tech to people, I remember like in SG last year, I was like, "Hi guys, does anybody know like how ChatGPT actually works?" And everyone was just like, "Oh." If you type things in, it answers you. And it's like, oh, it's a little bit more complex than that. There's this strange kind of like in medicine, there's a strange kind of like, like aversion to like very technical stuff. It's like, I'm dealing with, humans, I'm dealing with people. I don't really care about the tech. I just, I search it up, and ChatGPT is just like a fun tool to play with and something like that. And I think a lot of people are a little bit skeptical about the impact that ChatGPT can have. And they're like necessarily wary of it, but they don't give it much credence. And it's great that you're able to talk so much about the technical sides of medicine.
Well, I can see it coming, yeah, and I guess I put my hand up to go to the VR show and to see what's on the horizon. What else do I think about that? Sorry, I'm on the spot. Nothing else to say. Yep.
Do you have anything that you'd like to close with, talking about maybe why you think general practice is just the best thing ever? What advice you have for medical students?
I love science, and I'm really a nerd, as you can tell, and I love people. And so I think general practice gave me or gives me the opportunity to really be involved at a person level. I don't read novels because the patients, everything that could possibly happen in humanity, I've seen through the patients. And you have this incredible opportunity to see the other side of somebody that they wouldn't normally share with very many people. It's an incredible privilege, really. And so I don't think that human side of medicine will go. I know that the VR is very good at expressing empathy. I still think there's something about that human-to-human contact and caring, really. And so I guess my closing is keep general practice in mind, guys, because you do get to know the patients well, unlike the specialties where you see new people most of the time, give an opinion, off they go, and the GP puts it together. And I think VR's coming. It's just, that's how it is. Yeah.
Yeah. It'll slowly and religiously take over our lives.
Yeah. And we put our hands up to try and shape that by being interested in, anyway, I'll do that.
Yeah. Sounds good.